In studio with me is Dr. Andrew Mulwa. We're talking about vaccinating teenagers 18 years to 12 or 12 years to 18. We're looking at the reason why the government is moving that direction. Already the rest of the world is talking about this. The US has begun, several other countries have even gone below the age of 10. In Kenya, we began with vaccinating frontline workers, then 58 and above, then it was open to everyone. Right now, they're thinking about 18-year-olds. So the question is, what is the reason that has informed this? Do we have enough research, enough data to support the vaccination of 18 years and below? I'm speaking to Dr. Mulwa. Later on, I'll be speaking to two other very important guests here, Dr. Nora Obudo, East Africa Program Director at Women Lift Health, and Michelle Opio, Network Engineer. I'll be speaking to them about STEM, about science and women. So I'll be speaking to them later. But first, we bring back the conversation right here in studio with Dr. Mulwa. And Dr. thank you for holding on. And let me bring in the aspect of second doses, because one of the reasons you're saying the uptake is not as good as it's expected. Ordinarily, a normal patient in Kenya, once you get well, you don't go back to finish your doses. Is this the case, Dr.?
I would say for now we have not reached a level where we have a crisis in terms of defaulters. Our citizens are coming for their second doses. Of course, we have a few that are defaulting. Sometimes you realize it's a question of data capture and all. Some others, because of messaging platform, they have not gotten their reminder messages. But I think, by and large, working with the county governments, the counties, ministers for health, the county directors, the county vaccination logisticians, we have been able to trace and we have been able to put a lot of them on board. As at this moment, we are not worried about defaults because most of these people are coming for their second doses.
Okay, so most are coming for their second doses. The 18-year-olds and below, how do you intend to achieve this? Civic education, you're going to go out there and call on parents to allow their children to be vaccinated. You're operating, Daktari, against a background where even the parents are skeptic about getting vaccinated. Now you're going to ask them to present their children to be vaccinated. Don't you see this is a mountain that you have to climb?
Generally and across the world, and Kenya is one of the countries that do very well in terms of routine vaccination, where close to 90% of our children below the age of 5 get routine vaccination. So much as there are issues about vaccine hesitancy, I would say the demand in the country and the research, operational research that has been done shows that, in fact, the demand for the vaccine is higher than the vaccines that we do have. We may have a few pockets, a few areas where the communities have not been 100% convinced the importance of vaccines, and also with the low numbers of COVID-19 infections that we are recording in the country, there has been some reluctance, and the COVID-19, with the reopening of economy, there has been a negative message to the public that COVID-19 is like behind us, and so there is that natural reaction of population has taken. But we still continue with the advocacy, we continue with the messaging, we continue with education. But I think because 90% of our children get vaccinated for other vaccines, we introduced the HPV vaccine for teenage girls, which before COVID disruption, we were already doing 90%. I don't expect us to have major issues on this as a country, because we are a country that routinely vaccinates its people.
Okay, so you are confident using that history of vaccination, but again, consider this, that the vaccinations that you mentioned, that Kenyans routinely vaccinate their children from birth all the way to around 5, and of course the girls also, consider that is something that is preventive, and it's part of, how would I call it, the children's medical history. You're born, you have to be given these vaccines in order to survive some of those infant ailments. It's something that is known to the parents. This is an alien ailment that just came the other day, ravaged the whole world. So you are introducing it. My point is this: the parents that you're talking about are reluctant. Look at the numbers that you're reporting this morning. They're reluctant, and you're asking them to vaccinate their children. So how are you thinking of dispensing? How are you thinking of doing this?
I think, like I said, one, we will have a multi-sectoral approach where first to be clear that in terms of policy, we are considering. It has not yet become,
yes.
It's in terms of policy, we are considering looping in 18 and below in the vaccination. We have not yet as a policy, because there is still some authorization process that has to go through the Pharmacy and Poisons Board so that we open up that. That has not yet been done. This is what, like we stated at the beginning, we are mulling. We are thinking about doing, considering policy shift. Moving from, now we have already reached 18. We're now considering policy shift from 18 and below. But that has not happened. By the time it happens, we will have a strategy first on how to reach. First of it is multi-sectoral approach, where we bring all the sectors in the country, where young people are, especially the Ministry of Education, where we have parents as key stakeholders, and build their capacity, give them consistent and accurate knowledge on the importance of vaccination, share with them so that we may remove the barriers that may exist. So when we get there, the approach will be multi-sectoral approach. We will have everyone on board, engage all the stakeholders, religious leaders, community leaders, to ensure that we reach. The beauty about the younger populations, I'm talking about even between 20 and 18, most of these are institutions, whether learning institutions. So it is easier to, in terms of getting these populations in one place, it is easier than the adult population, which is not easy to have them in one place.
All right. And finally, one of the things that may have informed the decision to move to this population, apart from just the availability of the vaccines and the fact that frontline is done, 58 to 68 is done, is perhaps the quest for herd immunity, that you know that majority of the Kenyan population, about 75%, are made of young people. The quest to get herd immunity by going to the level where you have majority of the population, could this also have informed the move to 18 years to 12?
Absolutely. Kenya, like many African countries, has a big base of population where most of the population is young. In fact, the median age of the Kenyan population is 19, and that therefore tells you, and those above the age of 40 are actually 22% of the population. So therefore, you are talking about the big population being there. Then the other challenge is this population, much as they do not have adverse effects when they get COVID-19 infection, they are the carriers, because they get the infection, they become asymptomatic, but they still can transmit to the vulnerable population. So it's important to have them vaccinated as a strategy.
Okay. Very well said. Thank you so much, Dr. Mullo, for coming and speaking to us this morning, unless you have something else to add.
Thank you, Ken, to ask all Kenyans to turn out in large numbers and get vaccinated. For those who have not gotten vaccinated, the vaccines are there, the vaccines are safe, and we are going to work with the county governments and other stakeholders to ensure that we bring the vaccines as close as possible to where they live and work.
All right.
Thank you.
And if possible, one in the near future, perhaps door-to-door campaign, if it will be possible.
Yes.
Just at the storage logistics for these vaccines. But that's a step in the right direction. Thank you so much, Dr. Andrew Mulwa, speaking to us about vaccinating teenagers and why MOH is going that route. We'll be speaking to my other guests at the top of the hour, but first let's update you in some of the stories that are also making your headlines, because all eyes and ears are in the lower eastern region of the country.